Certainly. Let's delve even deeper into gastrointestinal bleeding, focusing on its pathophysiology, detailed diagnostic techniques, comprehensive management protocols, specific case studies, psychosocial implications, current research advancements, and public health initiatives. Detailed pathophysiology of gastrointestinal bleeding. Mechanisms of bleeding: upper GI bleeding, peptic ulcer disease. Ulcers erode into blood vessels leading to bleeding. Risk factors include Helicobacter pylori infection, NSAID use, and excessive alcohol consumption. Esophageal varices increase portal hypertension, often from liver cirrhosis, leads to distension of esophageal veins, which may rupture. Mallory-Weiss, vertical tears in the esophagus due to severe vomiting or retching can cause bleeding. Lower GI bleeding, diverticular disease. Diverticular can become inflamed or perforated, leading to hemorrhage. Colorectal cancer. Tumors can ulcerate and bleed, often presenting with changes in stool color or consistency. Inflammatory bowel disease or IBD conditions like Crohn's disease and ulcerative colitis can cause mucosal inflammation and ulceration, resulting in bleeding. Physiological response to bleeding. Compensatory mechanisms. The body initiates compensatory mechanisms such as increased heart rate and peripheral vasoconstriction to maintain blood pressure and perfusion. Activation of the renin-angiotensin-aldosterone system, or RAS, helps retain fluid and sodium. Comprehensive diagnostic approaches. Clinical evaluation. History taking. Important details include the onset, duration, and characteristics of bleeding, such as the color of vomit or stool, associated symptoms like abdominal pain or weight loss, and past medical history. Physical examination. Assess vital signs for signs of shock, for example, hypotension and tachycardia. Check for abdominal tenderness, rigidity, or distension. Laboratory tests, complete blood count or CBC, to assess hemoglobin levels for anemia, which is indicative of blood loss, and leukocytosis, which could suggest a potential infection. Coagulation profile, assessing PT, APTT, and INR to evaluate bleeding risk. Biochemical panel, to check liver function and kidney function, which can influence treatment decisions. Imaging studies. Endoscopy. Upper endoscopy, or EGD, provides direct visualization of the upper gastrointestinal tract to identify and possibly treat the source of bleeding, such as cauterization of ulcers. For lower GI bleeding, a colonoscopy allows for direct visualization and intervention, like clipping or cauterization. Radiologic imaging. A CT scan with contrast is useful for identifying sources of bleeding, especially in cases of suspected diverticulitis or malignancy. Angiography can be used for both diagnostic and therapeutic purposes, allowing for embolization of bleeding vessels. Comprehensive management strategies. Initial management. Fluid resuscitation. Administer isotonic fluids such as crystalloids to restore hemodynamic stability in cases of significant blood loss. Blood transfusion. This is indicated if hemoglobin levels drop significantly, typically less than 7 grams per deciliter, or if the patient is symptomatic. Monitoring. Continuous monitoring of vital signs, urine output, and mental status is essential. Regular CBC checks are necessary to monitor hemoglobin levels. Specific treatment for upper gastrointestinal bleeding includes both pharmacological and endoscopic interventions. For pharmacological interventions, intravenous proton pump inhibitors, or PPIs, are used for ulcer-related bleeding. They help promote healing and reduce gastric acidity. For variceal bleeding, octreotide is administered to reduce portal pressure. Endoscopic interventions include thermal coagulation or band ligation, which are effective for managing bleeding ulcers or esophageal varices during endoscopy. Specific treatment for lower gastrointestinal bleeding often involves a colonoscopy. During this procedure, therapeutic interventions can be performed, such as injection therapy with sclerotherapy or epinephrine to control bleeding. Additionally, cauterization or clipping can be used to seal off bleeding vessels. In cases where patients do not respond to endoscopic treatment or have a massive hemorrhage, surgical intervention may be necessary. Complications of gastrointestinal bleeding can be quite serious and require long-term management. Hypovolemic shock. Severe blood loss can lead to shock, requiring immediate resuscitation. Anemia. Chronic blood loss can result in iron deficiency anemia, necessitating iron supplementation or transfusion. Infection, post-surgery or prolonged hospitalization can increase the risk of infections. Recurrent bleeding. Some patients may experience episodes of recurrent bleeding requiring ongoing management and monitoring. Long-term management and follow-up. Follow-up care, regular monitoring for patients with underlying conditions like inflammatory bowel disease or diverticulosis to manage and prevent future episodes. Screening for malignancies. For patients with a history of colorectal bleeding, regular screenings such as colonoscopy are essential to detect potential malignancies early. Psychosocial aspects. Patients may experience anxiety about the risk of rebleeding or changes in lifestyle due to dietary restrictions. Engaging family members and providing access to counseling services can help patients cope with the emotional burden of gastrointestinal conditions. Research and future directions. Biomarker research, investigating biomarkers that can help predict the risk of gastrointestinal bleeding or complications in patients with known risk factors. New treatment modalities, ongoing studies into novel therapies that may improve outcomes for patients with acute gastrointestinal bleeding, including better anticoagulation management in patients with atrial fibrillation. Telehealth innovations, utilizing telemedicine for follow-up care in patients with chronic gastrointestinal diseases can improve access to specialists. Public health considerations. Awareness campaigns, initiatives to educate the public about recognizing symptoms of gastrointestinal bleeding and the importance of seeking timely medical care. Screening programs, targeted screening for high-risk populations like older adults and those with a family history of gastrointestinal disease to facilitate early detection and management. Conclusion. Gastrointestinal bleeding is a critical condition that requires prompt recognition and effective management to prevent significant morbidity and mortality. Understanding its pathophysiology, diagnostic approaches, and treatment strategies is essential for healthcare providers. Ongoing research and public health initiatives are vital for improving outcomes and enhancing awareness of gastrointestinal health. If you have specific questions or areas you would like to explore further, please let me know.